Your mouth is dry. Not because you didn't drink water. You drank plenty. Your eyes burn by midday. Not every day. But enough days that you've started noticing. Maybe your tongue feels strange sometimes, thick, sensitive, like something changed that you can't quite explain. Maybe your energy crashes in the afternoon for no clear reason. Maybe your memory has felt slower. Maybe your joints ache on days when nothing happened. And maybe you've brought this up to a doctor, maybe more than once, and each time you've heard one of these, you're probably dehydrated, this could be stress, that's a common side effect of your medication, it's just part of getting older. And you walked out with that answer, and it made sense, so you accepted it. But here's the thing. In some cases, not all but some, those symptoms aren't unrelated, they aren't coincidence, and they aren't aging. They may be early signs of a pattern that has a name, and that name is Sjogren's syndrome. And if you've never heard of it, you're not alone, because most people haven't, not because it's rare, it's actually one of the more common autoimmune conditions, but because its symptoms are easy to explain away, one by one, which is exactly why it gets missed. In this video, we're going to walk through what Sjogren's syndrome actually is, the difference between primary and secondary symptoms, how this condition can quietly expand from localized discomfort to a wider pattern affecting your nerves, your energy, your cognition, and why that difference may explain why so many people spend years chasing the wrong diagnosis. This video is educational, nothing in here is a diagnosis, but if any of this sounds familiar, stay with it, because this might be the explanation you've been missing. Before we go any further, if you've ever been told your symptoms are just stress or dehydration and it never fully felt right, type primary in the comments right now. If that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send it to you directly. Because what I'm about to show you next is why that map matters more than most people realize, and why the stage you're in changes everything about what happens next. Sjogren's syndrome is an autoimmune condition, which means the immune system, the part of your body designed to protect you, begins targeting something it shouldn't. In Sjogren's, it primarily targets moisture-producing glands, the glands that make tears, the glands that make saliva, and in some cases glands in other parts of the body as well. When those glands are affected, they don't produce as much moisture as they should, and that's why dry eyes and dry mouth are usually the first signs people notice. But here's what makes Sjogren's different from ordinary dryness, it doesn't just stay in the glands. For some people it does, and that's called primary Sjogren's, which we'll break down in detail, but for others the immune activity can expand, the nervous system can become involved, the joints, the skin, the kidneys, the lungs, and that expansion from glandular to systemic is where things get complicated. That's where people start getting dismissed, that's where the confusion about diagnosis tends to begin, and that's what this video is really about. Now before we go deeper, let me give you some quick background on who this tends to affect. Sjogren's is more commonly diagnosed in women, and most diagnoses happen between ages 40 and 60, though it can appear earlier or later. And here's a number that explains a lot. The average time from first symptoms to diagnosis has been reported at somewhere between 6 and 10 years in some studies. 6 to 10 years. That's not because the doctors aren't trying, it's because Sjogren's looks like so many other things and its symptoms shift over time, and that's the whole point of this video. Let's start at the beginning. Primary Sjogren's refers to the condition on its own, not associated with another autoimmune disease, and for most people the story starts in one of these 5 places. The first is dry mouth. You know what dry mouth feels like, everyone's had it after a long sleep or after too much coffee, but Sjogren's dry mouth is different because it's persistent, it's there in the morning, it's there after drinking a full glass of water. Some people describe it as a sticky feeling they can't wash away, difficulty chewing dry foods because there isn't enough saliva to break things down, trouble swallowing especially at night, and a feeling that their lips are cracking from the inside. What people dismiss it as is not drinking enough water, medication side effects, or anxiety, but what may actually be happening is that the salivary glands may be producing less saliva than normal because immune cells are affecting the gland tissue. Why it matters is that saliva isn't just for comfort, it protects your teeth, it contains enzymes that start digestion, it has antibacterial properties, and when saliva production drops consistently, dental problems can follow, sometimes quickly. People with Sjogren's often develop cavities, tooth sensitivity, or gum issues in ways that don't match their dental hygiene habits, and that can be a clue. The second is dry eyes. Dry eyes in Sjogrens often feel different from ordinary dryness and may show up as a burning or gritty sensation like something is in your eye, eyes that are worse in the afternoon or evening, sensitivity to light, wind, or air conditioning, and redness that doesn't respond well to standard eye drops. What people dismiss it as is screen time, allergies, or contacts, but what may be happening is that the lacrimal glands, the glands that produce tears, may not be producing adequate tear film. And this isn't just about volume because Sjogrens can affect the quality of tears including the layers that keep the eye surface stable. Prolonged dryness can affect the corneal surface, and persistent eye symptoms that don't respond to usual treatments are one of the patterns that sometimes prompts a Sjogrens investigation. The third is burning tongue or oral sensitivity, and this one is often overlooked. Some people with Sjogrens describe a burning sensation on the tongue or inner cheeks, a metallic taste, increased sensitivity to spicy or acidic foods, and a feeling that food tastes different than it used to. What people dismiss it as is nutritional deficiency, acid reflux, or stress, but what may actually be happening is that reduced saliva can alter the oral environment, its pH, its bacterial balance, and its nerve sensitivity, and some researchers believe nerve involvement around the oral tissue may also play a role in some cases. The fourth is dental deterioration. If you've been diligent about dental hygiene and still developed cavities, sensitivity, or gum recession in ways that seem disproportionate, that pattern matters, because dentists sometimes notice patterns in Sjogren's patients before rheumatologists do, and that's how important this symptom can be as a clue. The fifth is swallowing discomfort. Some people describe difficulty swallowing, especially dry foods, a feeling of food getting stuck, or discomfort when eating certain textures, and this is often linked to reduced saliva in the esophageal lining. It's easy to explain away, but taken alongside other symptoms it can be part of the same pattern. Here's a pause point. If any of those 5 symptoms sound familiar, persistent dry mouth, dry eyes, burning tongue, dental changes, or swallowing discomfort, type primary in the comments right now because I'm building a symptom map specifically for this video and I want to make sure it gets to you. Type primary below. Now here's where the conversation changes. For some people, Sjogren stays focused, glandular symptoms managed with eye drops, hydration strategies, dental care, and treatment from a rheumatologist. But for others, not everyone but some, something else starts to happen and the symptoms expand. The dryness is still there but now there's something else, fatigue that sleep doesn't fix, a fog over your thinking, a nerve sensation that comes and goes, balance that feels slightly off, pain in joints that weren't painful before. This is what we call the shift. And this is where Sjogren stops feeling like a comfort problem and starts feeling like a function problem. So let's break down what that can look like. If you feel like your symptoms changed over time, like something shifted from discomfort to something harder to describe, type shift in the comments because you might be experiencing what we're about to cover. Shift, drop it below. When Sjogren's moves beyond the glands it can affect several different systems, and we'll go through the 4 most commonly reported. The first is fatigue, and not regular tiredness. Sjogren's-related fatigue is often described as a heaviness that doesn't lift after sleep, energy that crashes without warning, a physical exhaustion that doesn't match activity level, and needing to rest more than before even on easy days. What people dismiss it as is poor sleep, depression, anemia, or age, and fatigue is one of the most commonly reported symptoms across dozens of conditions so it doesn't point to any one diagnosis on its own. But what may be happening in Sjogren's is that ongoing immune activity requires energy, and inflammatory processes even at low levels can affect how the body regulates energy. Some research also suggests that immune involvement in the nervous system may contribute to fatigue patterns in certain Sjogren's cases, and while fatigue is frequently dismissed as the least specific symptom, when it appears alongside dryness and other patterns it becomes more significant. The second is brain fog and cognitive symptoms. And this one is particularly hard to explain to someone who hasn't experienced it. Sjogren's-related brain fog may show up as difficulty finding words in conversation, forgetting things that feel like they should be easy to remember, trouble concentrating for extended periods, a sense of mental slowness that wasn't there before, and reading the same paragraph multiple times without it landing. What people dismiss it as is stress, anxiety, perimenopause, or poor sleep. But what may be happening is that some researchers believe Sjogren's-related immune activity can in certain cases affect the central or peripheral nervous system in ways that influence cognitive processing. This is an active area of research. It is not fully understood, but it is taken seriously in rheumatology. Cognitive symptoms are subjective, they are hard to measure in a standard clinical visit, and they often appear years after the initial dryness symptoms, making the connection non-obvious, which is exactly why it gets missed. The third is peripheral neuropathy, or nerve symptoms. Some people with Sjogren's experience nerve-related symptoms that may include tingling or numbness in the hands or feet, burning sensations that come and go, a feeling of pins and needles without pressure being applied, sensitivity to temperature changes, and in some cases pain along nerve pathways. What people dismiss it as is circulation issues, vitamin deficiency, or stress, but what may be happening is that in some Sjogren's cases immune involvement can affect peripheral nerves, the network of nerves outside the brain and spinal cord, and this can disrupt the normal transmission of sensation signals. Nerve symptoms associated with Sjogren's don't always appear alongside obvious dryness, and in some reported cases neuropathy was actually the presenting symptom before dryness was obvious, which is one reason the condition can be so difficult to connect. The fourth is balance and vestibular symptoms, and this one is less commonly discussed but worth naming. Some people with Sjogren's report a sense of mild imbalance or unsteadiness, dizziness that isn't vertigo but isn't quite right either, and difficulty with spatial awareness in certain environments. What people dismiss it as is inner ear issues, blood pressure changes, or anxiety, and vestibular symptoms rarely appear on standard Sjogren's awareness materials, which makes them hard to connect to an autoimmune condition without a thorough workup. Now here's the important thing to understand about all of these symptoms: they don't all appear at once, they don't appear the same way in every person. Some people have mild systemic involvement, some have significant involvement, and some have none beyond the primary glandular symptoms. Sjogren's is not a one-size-fits-all condition, which is partly why the diagnostic journey is so often long. If you've experienced any of those patterns, fatigue, brain fog, nerve symptoms, or balance changes, alongside dryness or other early symptoms, type shift in the comments below, and if you haven't already typed primary, drop that too, because I'm tracking both for the symptom map. Now we get to the part that causes the most confusion, and that's secondary Sjogren's. Secondary Sjogren's refers to the condition appearing alongside another autoimmune disease, and the most commonly associated conditions include rheumatoid arthritis, systemic lupus, scleroderma, primary biliary cholangitis, and in some cases fibromyalgia-like symptom clusters. Here's why this matters so much. When you have two conditions overlapping, the symptoms don't stay in separate lanes, they mix, and when they mix, even experienced clinicians can find it difficult to know which symptom belongs to which condition. Joint pain is a classic symptom of rheumatoid arthritis, lupus, and also Sjogren's. In primary Sjogren's, joint pain is often described as affecting multiple joints, not always causing visible swelling, migratory meaning it moves between joints, and often accompanied by stiffness, especially in the morning. In RA, joint pain tends to be more symmetrical, more progressive, and often with measurable joint damage over time. But here's the clinical trap: if a patient already has RA and develops dryness, fatigue, and cognitive symptoms, those may be dismissed as side effects of RA treatment or simply as additional RA features, which means Sjogren's may not be considered, the dryness doesn't get treated appropriately, the nerve symptoms may not be investigated with Sjogren's in mind, and the full picture stays incomplete. Fatigue overlaps in Sjogren's, lupus, fibromyalgia, and RA, and when a patient has a confirmed diagnosis of one of those conditions and then develops significantly worse fatigue, the most common assumption is that the known condition is progressing, but in some cases an additional condition like Sjogren's may be contributing. And the treatment approach for Sjogren's-related fatigue may be different from the approach for lupus-related fatigue, which means missing the second diagnosis means treating incomplete information. Here's something that doesn't get talked about enough. Many people with secondary Sjogren's describe a persistent feeling that their symptoms don't fully fit their diagnosis. Their RA is under control by blood work, but they still feel exhausted. Their lupus is managed, but the dryness is getting worse and the brain fog is heavy. Their fibromyalgia explains the pain but not the eye symptoms, not the dental changes, not the neuropathy. This feeling, "I don't quite fit the label I was given," is one of the most consistent patterns in secondary Sjogren's, and it's the clue worth paying attention to. If you've ever felt like your diagnosis explained most of your symptoms but not all of them, type overlap in the comments, because that feeling matters. It's not just frustration, it may be information. Type overlap below. Let's break down the 4 patterns that rheumatologists and neurologists often look at when Sjogren's is being considered, especially in cases where the diagnosis has been delayed. These aren't diagnostic criteria, these are patterns worth knowing. Pattern 1 is dryness plus nerve symptoms. Dry eyes or dry mouth alongside tingling, burning, or numbness, especially in the extremities, is a combination that warrants further investigation in some cases, and this pairing is one of the more common reasons neuropathy gets reconnected to Sjogren's in patients who were previously told the nerve symptoms were unrelated. Pattern 2 is fatigue plus cognitive symptoms. When fatigue and brain fog occur together and they don't fully respond to sleep, stress management, or thyroid treatment, it's worth asking whether an autoimmune component could be involved, and in Sjogren's this pairing is commonly reported. In patients where this combination appears alongside any dryness, however mild, it's a pattern that some specialists find meaningful. Pattern 3 is joint pain plus dryness without RA markers. Joint pain without significant elevation of traditional RA markers alongside persistent dryness is a combination that sometimes leads to Sjogren's being identified, and standard RA panels don't always detect Sjogren-specific antibodies, which is why specific tests like anti-SSA and anti-SSB antibodies may be needed. Pattern 4 is normal scans with real symptoms, and this is possibly the most important pattern of all. Some people with Sjogren's, particularly those with neurological involvement, go through MRI scans, nerve conduction studies, and blood work that come back within normal limits and are told everything looks fine, but they still feel wrong. In some cases that's because the type of nerve involvement in Sjogren's doesn't always show up on standard imaging. Small fiber neuropathy, a type of nerve damage affecting the smallest fibers, can be associated with Sjogren's in some cases and it doesn't show up on standard nerve conduction testing. It requires a specific test called a skin punch biopsy to detect, and this is the kind of detail that gets people years of normal results while they continue to experience real symptoms. If you recognize any of those 4 patterns, dryness plus nerve symptoms, fatigue plus brain fog, joint pain without RA markers, or normal results with real symptoms, type scorecard in the comments and I'll send you the full side-by-side pattern breakdown that you can use to organize your own symptom history. Type scorecard below. Let's make this useful. If anything in this video resonated with you, here are some practical things you can do before your next appointment. Step 1 is to build a symptom timeline by writing down in order when your symptoms first appeared, not just the current symptoms but the early ones too. When did the dryness start? When did the fatigue begin? When did cognitive symptoms appear relative to physical ones? A timeline is more useful to a specialist than a list because it shows pattern and progression. Step 2 is to note what makes symptoms worse, whether that's heat, activity, time of day, stress, or certain foods, because this helps distinguish between systemic patterns and situational triggers. Step 3 is to document your dental history. If you've had significant dental changes that didn't match your hygiene habits, bring that history and mention it explicitly, because dentists and rheumatologists don't always share records. Step 4 is to know the specific tests to ask about. If your doctor is open to investigating Sjogren's, some questions worth asking are, could we test for anti-SSA and anti-SSB antibodies, which are Sjogren-specific antibodies that general autoimmune panels don't always include? Would a Sjogren's test be appropriate, which is a simple test for tear production? Given my nerve symptoms, would a small fiber neuropathy evaluation be relevant, which opens the door to a skin punch biopsy if appropriate? And is a referral to a rheumatologist with Sjogren's experience worth exploring, since not all rheumatologists have the same depth of experience with this condition? Step 5 is to not minimize. Many people with Sjogren's, looking back at their diagnostic journey, describe a pattern of minimizing their symptoms in appointments, saying things like it's probably nothing, or I don't want to seem like I'm overthinking, or the dry eyes aren't that bad. Present your symptoms clearly and completely, bring notes, use your timeline, because your doctor can only work with what you share. If you want the complete symptom tracker template, the one you can fill out and take to your appointment, type symptom map in the comments right now and I'll send it directly. Symptom map, drop it below. Let's bring everything together. Primary Sjogren's often begins with symptoms that are easy to dismiss individually: dry mouth, dry eyes, fatigue, dental changes, and one by one each has a simple explanation, but together as a pattern they may point somewhere. Secondary Sjogren's adds another layer because when autoimmune conditions overlap they don't announce themselves clearly. The joint pain gets attributed to RA, the fatigue gets attributed to Lupus, the cognitive symptoms get attributed to fibromyalgia, and Sjogrens, which may be present and active, goes undetected for years, sometimes a decade. And then there's the systemic expansion, the shift from glandular to neurological, from discomfort to function, from dry eyes to brain fog, nerve pain, and balance issues. That shift isn't inevitable and not everyone experiences it, but for those who do, and for those who've been told their symptoms are unrelated, knowing this pattern exists matters. When symptoms feel disconnected, when you can't find the thread, it doesn't always mean there isn't one. Sometimes the thread is there, it's just been given different names by different doctors. Primary, secondary, systemic, overlap. Sjogrens has a way of making the whole picture look like separate pieces, and the people who find their way to the right diagnosis are often the ones who held the full picture together themselves. That's what this channel is for, not to diagnose, not to alarm, but to give you the language, the patterns, and the questions that help you walk into that appointment better prepared than you walked in last time. Before you go, 3 things. 1. If any part of this video resonated, drop a comment below with whatever applies to you. Type primary if the glandular symptoms hit home, type shift if your symptoms have expanded over time, type overlap if you felt your diagnosis was incomplete, type scorecard if you want the pattern breakdown, type symptom map if you want the tracker for your doctor visit, or just type my story and tell me what you've been through, because I read every single comment. 2. If this helped you, share it with someone, not to scare them but because the average person with Sjogrens waits 6 to 10 years for answers and a video like this might cut that down. 3. Subscribe because we cover autoimmune conditions, symptom patterns, and diagnostic gaps every single week, and the next video covers another condition that frequently overlaps with Sjogrens and is just as commonly misunderstood, so you don't want to miss it. Take care of yourself. Ask the hard questions. And remember, your symptoms are data.